would probably be good to start with to see how their skin reacts to it. Later on, and then incorporate your tyrosinase inhibitors and hydration. So Microderm would be a good go-to because you're not messing with the, you're not going to create any redness anymore. You know, it's not going to pop off from like a spot treatment and turn bright red. It's not going to create exfoliation on that level. It's going to be a nice even exfoliation. I'm going to put eye pads on her, but I can promise you I'll end up taking them off just because of my experience. But we need to make sure the eyes are covered, especially when you guys are learning. And you can use cotton rounds or whatever. I just had the 4x4s. When you guys are learning, because you don't want to get the crystals in the eyes. If it's diamond tip, you don't have to worry about it. Okay. So I'm going to do half diamond tip. And with this tip, you want the tips with the hole right in the center. That's what fits on here.
Are there different ones?
Mm-hmm.
Yeah, some of them have.
It's offset a little bit.
This one on the slanted part, that fits a different tip. Will you go see if there's tips on the by the quads and grab one if there is one?
There's nothing here.
Okay, thank you. No, it's not gonna fit. And the tip has to fit around these rings or it won't hold the suction. Here we go. Yeah, yeah, yeah. Got one.
It won't be in there.
Uh-uh.
Okay. So I'm going to start. I've got everything. I like to run it on my hand first to make sure. Okay, the suction is clean. Help cover the tips and see the suction.
They're all on the side. These are all, I think these are all on the side.
Oh, okay, beautiful.
No, but I don't think it's in the center.
Oh, they're on the side. Okay,
Yeah.
well, we've got 3. We can work with
Okay.
those.
You find one?
Okay. So I blotted the face dry. Now I'm going to go and start my Microderm treatment. I'm going to put the tubing around my neck so it doesn't start hitting my client. Now I'm going to pull the skin taut, and hers is easy to demo on. But if your client has more mature skin, it's about pulling the skin taut, and you're going to go and you want make sure the hole is covering. You don't want the hole tipped up so it's not, a lot of people will do this, and you've got to follow the wand, and this is part of the practicing of Microderm. It sounds very basic, but it's the mistakes that people make.
Here's this one.
Oh, okay, thanks.
Yeah.
I don't know. And it's just getting used to holding this. So you want to follow this the way, thank you, of the skin. So you've got to keep your wand, the hole flat on the skin, follow it all the way down and follow the curvature of the face. So I'm going to keep it here. I want her to feel the prickliness. Can you feel that?
Mm-hmm.
Okay, is it too strong?
No, it's
And you can see this little striping going on. That's the exfoliation from the crystals, but what can happen with microdermabrasion,
Scratching.
and you just wait, you can see it's dissipating. It can be if the suction's too high, or if the crystal flow is too high, you can get what's called striping, and people will get stripes on their face and leave, and it won't go away for a few hours, and that also can produce hyperpigmentation. So if you find that you're starting to do that, there's something wrong. Like Debbie and I noticed a lot of clients, students were getting that, and there's really not a lot to do about it. And it ended up to be the tips were messed up, so we had to get new tips. A lot of different things can go wrong, but you can usually figure it out. When I put the tip onto the skin, I'm slightly lifting up to kind of pull the skin up, so it will pull the skin up and the crystals can slough off the dead skin cells.
Versus pushing down. And
Yes, versus
breaking.
pushing down. Thank you.
It's like not really applying pressure. It's like
Right,
having it
right.
lead you a little bit,
It's
but
not about
keeping
that,
connected
yeah.
to the skin, right?
You don't want to apply pressure. And also, if you find you've got a more mature skin client that has a lot of loss of elasticity, you can do shorter stripes, shorter strokes, shorter passes. With her, we don't really need to worry about it. She's got nice plump skin. The faster you go, the less exfoliation will occur. So a lot of people will try to hurry up through their treatment and get finished, when really they're not doing anyone any favors, because they're not letting it do what it's supposed to do. That's why I like to talk to my client. Can you feel? She said yes. Now with the microdermabrasion, you can go up into the hairline. I mean, granted, there are crystals. Okay, there we go. Then we're going to do our second pass. That's one pass. One way is one pass, the second pass is up. If you want to do one pass all over and do the second pass all over, you can. If you want to do portions, you can. It doesn't matter, as long as you can remember what you've done. I'll never, on the crystal side, come down and finish this pass and lift up so the crystals fall into our eye. So you're always going to start here and come to the hairline. I'm going to hold right here to hold the skin taut. You still feel it?
Mm-hmm.
Is it too prickly?
No, it's good.
And with the exfoliation comes the transepidermal water loss, and also it leaves it open for any kind of activity, whether it's bacteria or anything else. So we just want to make sure and get the water moisture back in after. Now, if I were doing crystal microdermabrasion all over her face, I would come over here and do the second part of the forehead. I'm just going to do the middle part. If you have someone with super rough texture, say like up here, you can do this motion back and forth. Not necessarily on her young skin do we want to do that, but like on someone with dry patches or a hyperpigmented area,
Like this?
one spot, you can do that, but you've got to make sure it's an old hyperpigmentation, because if it's a newer hyperpigmented area, it's still very active. You have to start using your own judgment on that. So it's just kind of your own call. But there are a lot of things to take into consideration. And then I'll dust the crystals down away. Okay, turn your head. And remember, the skin around the eyes is much thinner, so I'm going to pull the skin taut here. I'm going to come down. I'll come in a V, never going towards the nose. I'm going to pull skin taut here and come up on the bone. We should have cotton in our ears. But look at that, pinkness is very healthy. That erythema is very, very healthy. It's getting the blood supply to the surface of the skin, which is, she exercises all the time, but you know, for people that don't have a lot of movement or don't do anything, it's very healthy for the skin. And then to come down on the, no, I have to take these off, sorry. To come down on the, I'm going to come here and do my V in the forehead. up. Push those out of the way. The tip of the nose is very difficult to get because it's so bony. The cartilage, I should say, is so thin. You're not going to get the best covering. It's difficult to reach. So what I like to do is just focus on the tip. I'll kind of swiggle it back and forth so it keeps the suction. Goes out of the way. She has some dryness on her nose, so it's okay. I'm taking my time. That hurt? Sorry. And that's what you want to be careful of. Did any get in your eye?
Oh.
And just communicate with your client like that. You've got to be aware. Okay. I can come over here and come up like this. And then to get the neck, you can turn your client, pull the skin taut like this. This is a little bit more difficult when they have older, more mature skin. You'll hear it pop up and kind of drag. With younger skin, it's not an issue, but most women that come in, you have to just find a way to pull the skin taut and do shorter strokes, shorter passes, because the longer you go, the more suction it accumulates, which makes it more apt to creating a hickey-like mark on the skin. If you are comfortable with your wand and you can follow the contour of the chin around the corner, that's fine. Otherwise, you can just stay horizontal and come across and do your pass that way. If you have to do a pass the same direction, that's fine. You still need to give your client 2 passes. If you're having a hard time making a vertical strike or whatever pass, it's okay. You can do a horizontal one at the same time, just do it at 2 different times. So you would do horizontal here, finish this, come back, do horizontal here, if it's not possible for you to do 2 different directions. Okay, so that's half the face. Now we're going to demo the diamond tip, which is here. And how we do that is to pull this down and pull this tubing out. I think it's the yellow one. And then we're going to use the handle here. This here. Here, and then we'll use this one's the most appropriate, especially when you're learning. It's the most gentle. So she's felt the crystal side. That feels okay. And you can use a brush. Is there a brush over there? A mask brush? One of those paint brushes? Oh, they're in that now. Okay.
Clean.
Awesome.
How can you tell Kristen, you had just said that that one's the